Hi, and welcome to AAHPO's American Armenian Health Professionals TV Health Program. We all take medications, either prescription or over-the-counter, to get better from illnesses. And some take supplements, it could be herbal or synthetic, to feel better. But they all can be harmful if they are taken without advice coming from a professional, either a physician or a pharmacist. Today our guest is pharmacist Vatche Demirjian, who is postdoctoral associate professor at Rutgers University. Mr. Demirjian, welcome to our program.
Thank you for having me.
This is a very extensive program, so we can probably go as much as we can in the first program. So let's clarify first for our audience between original prescription medication and the generic ones. What is the difference between two?
Sure thing. So whenever a medication goes through the approval process, it first begins with large pharmaceutical companies, the Mercks of the world, Pfizer, AstraZeneca, and they spend hundreds of millions of dollars over the course of 10 to 15 years developing these medications. After the completion of phase 1, phase 2, phase 3 studies, they can be FDA approved. Once on the market, a patent is good for approximately 20 years. So that means that only that manufacturer is able to make that medication for 20 years.
And then price as much as they want.
And price as much as they exactly.
So after patent ends, what happens?
So at the conclusion of that patent, generic manufacturers have the option to start making that medication.
Right. But sometimes the original companies make their generic too.
That's correct. They do that too as well. The generic company needs to make sure that the chemical that they are producing is bioequivalent to the reference brand name product.
So then we can say, really, the generic medication, chemical-wise, bioequivalent or equivalent to original product.
Correct. So they don't necessarily need to go through 10, 15, 20 years of development or anything like that. All they need to do is prove that their product is bioequivalent to the reference product. So they need to make sure that it gets absorbed the same way in the body. They need to make sure that it gets eliminated through the bloodstream the same way. So very pharmacokinetic and pharmacodynamic studies need to be done in order to just make sure that it's as similar as possible to that reference product.
Right. So once really they show that yes, it's bioequivalent.
Yes.
So when we write the prescriptions for our patients, then we can say comfortably, look, this is bioequivalent, this is identical medication almost, but the price difference is significant.
It's very significant.
Right.
And so in order, all the time, whenever you receive a prescription, the generic needs to be dispensed, unless indicated on the prescription that brand name only by the physician is written on the prescription.
Which is very few times that I write, because sometimes very tight control of a hormone or something that I need, very certain titer, and then I write. Otherwise, really, I know that they are bioequivalent, so there's no differences that they can comfortably take it.
Correct.
As a matter of fact, sometimes in Europe and in Canada, it's automatically given.
Correct.
Yes, right, and unless there's written otherwise, but usually automatically given. It means that they are doing all right, we should be doing all right. So they shouldn't be afraid of taking a generic medication.
Exactly.
So let's talk about the herbal medications that we have, over-the-counter vitamins and herbal medications. Let's touch upon a little bit of herbal medications. What are they?
Herbal medications can be things like green tea extract. They could be supplements like magnesium or calcium, things like that. Most of the time, these agents they never go through an FDA approval process. They're just manufactured and they get to go on the shelf.
And they're usually considered as safe.
Correct.
Without any FDA checking on them.
Correct. Right. So with regard to herbal supplements, there's no regulation from the FDA. So unfortunately, if a product says, 2,000 international units of vitamin D, the CVS brand might have 2,000 units, but then the Walgreens brand, the Target brand, et cetera, they don't measure and they don't do well-controlled studies to make sure that the dose matches the label.
Our concern is that in medicine, usually when we write prescription medication for some diseases or blood pressure or it could be any other condition, and when people or patients, they go and take supplements, herbal supplements or vitamin mineral supplements, we are a little concerned sometimes because they can interact with each other.
Oh, of course.
Yes. So let's talk about that a little bit. Interaction of this herbal medication or over-the-counter medication versus prescription medication?
Sure thing. So once you go to the pharmacy, if you're picking up an herbal supplement, the pharmacist or the physician, they're not really doing drug interaction studies to make sure that the two products are going to be safe. So it might go under the radar that you're on these two. So that's why it's always important to tell your physician or pharmacist what over-the-counter supplements and herbal products you're taking. A good example of this is warfarin. A lot of patients take warfarin as a prescription.
This is a blood thinner. Warfarin is the most commonly used blood thinner.
Very, very common blood thinner. There's a medication available that's a herbal supplement called ginkgo biloba, which is thought to improve neurological function. And a lot of patients take it, usually patients above the age of 60 or 65. It's a common supplement to take. However, this medication significantly increases the risk of bleeding when also on warfarin. So that is an important indication to know that you might be taking this supplement, you might think that it's safe and there's no risk of adverse effects, but if you're taking other prescription medications, it can have severe adverse effects when taken together.
Let's talk about the vitamins and minerals. Actually, what vitamins are fat-soluble, which they have to be utilized, they cannot be eliminated in the body? Vitamin A, vitamin D and K, right?
Yeah,
but those four, they're fat-soluble, so they cannot be eliminated unless they're being utilized properly.
Correct.
But on the other hand, some water-soluble vitamins have side effects. Yes, neurological side effects can be.
Yes.
Excessive vitamin Bs can have a neurological side effects
Correct.
too.
Yep.
So they have to be really careful then in that matter. Okay, let's go from that topic now. Let's talk a little bit about the elimination of the medications. So they come to you and let's say it's prescribed medications. What are the things that you're watching about those medications?
Sure. So when we think about elimination from the body, we kind of think of two organ systems. We think of the hepatic system or the liver, and the nephrology or the kidneys, right? So those are primarily the two ways where medications can be eliminated.
Right. So the liver is important in a way, but because most of the medications, right, 80%, 70 to 80% of the medications
the vast
go
majority.
through the liver, majority, and then some go through the kidney.
Right.
I'm sure the pharmacists, they know what the clearance from the kidney. What do you do actually? Let's tell the audiences, what do we look for?
Where do we go?
Yeah.
Right. So every person has a specific function that we can measure your kidney function, and there's something called creatinine clearance. And based on what your level is, we can determine what dose of medication ideally you need to be on. If your creatinine clearance is normal, above, let's say, 60 mLs per minute, let's say, you can take the vast majority of medications and you're going to eliminate it totally fine. But if your kidney function is decreased, well, we need to lower some of those medications because they're going to be in the body longer and you're not going to eliminate them as well.
And we want to clarify something very important. You might have a diminished kidney function without any symptoms at all.
Right.
You'll be urinating normally, you will not be having any symptoms at all, but your kidney functions might be lower. How about the liver? Because majority of the medications go through the liver. What signs or symptoms or what blood tests you're looking for to adjust that? Is there anything that you're looking for as a pharmacist?
Right. So hepatic impairment, although possible, it's a little bit less common than kidney impairment. Right. What we look for in the liver is specific enzymes and transaminase levels. So we have something called AST and ALT, and these markers evaluate someone's liver function. So if they're really, really high, that's a marker to us that there might be something going on with the liver. You might have a yellow tint to your skin, or your eyes there might be a yellow tinge to them. That's a marker of hepatic dysfunction. And when these levels are really, really high, we need to look at the medications that you're on. You might be having toxic effects from a certain medication, or you might even need to go to the hospital.
Right. So that's just sometimes the patients could be even in the hospital. The pharmacists in the hospital, they check the liver function test, which you said SGOT, SGPT, sometimes alkaline phosphatase, we check to see if there's any blockages there or so. And then the elimination changes, obviously, the adjustment, even though it's not as accurate as creatinine clearance, we can adjust the dosages, but then we'll be more careful about the elimination of those medications through the liver.
Right, and then we also need to look at what are the other medications that the patient is on. If they're on Tylenol, for example, and they have poor hepatic function or poor liver function, we don't want to be using Tylenol. Exactly. We want to try and stay away from that. We want to use a different agent.
So when we're talking about liver functions and kidney functions, these are not necessarily for only prescribed medication. We are talking about any over-the-counter medication.
Any over-the-counter, right.
All the medications, all the herbal medications, all over-the-counter medication, they have to go either through the liver to be utilized, through the kidney to be utilized. So they have to be careful then for OTC medication, over-the-counter medication, and herbal medications too. Now time is up. We will continue this good program next time. And good health is precious and priceless. Keep yourself up to date visiting AAHPO's website. It's aahpo.org. I'm Dr. Ohan Karatoprak. Until next program, a continuation of this program.